When you think about a population that all have the same disease, like diabetes, maybe it's 100 individuals in your panel. If you're a doc, that was probably a lot more, but let's just use a round number like 100. And let's even say that most of them have the same lab values, so hemoglobin A1C. Some of them are starting to worsen and some of them are starting to get better. So their diabetes, in some respects, is getting more out of control or under greater control. All of them may be treated the same way at a start. What we don't know, and what we know from data, but maybe what the provider in front of that patient doesn't know, is that maybe those individuals whose hemoglobin A1C is starting to get worse, right? And they're in the emergency room, or they're having challenges with diabetic ulcers on their feet. Is it that maybe those subpopulations with those challenges and those poor outcomes have high risk for food insecurity? They don't have transportation and haven't been able to pick up their medications at the pharmacy. They struggle financially with keeping the utilities on and can't keep their insulin refrigerated. And as the doc, most of the time, and certainly historically, they've been blind to that information. I just have the labs in front of me. I know what I prescribed the last time. I know if they've been to a specialist, maybe what that specialist said. But I don't know anything else about their life. And I don't know why they might be struggling, why their outcomes are poor, and what barriers and challenges exist in their life that could be mitigated through specific interventions for that patient.